we'll be discussing the dressing of a tidy wound, and over here we can see some pictures of tidy wounds. Before we get into the dressing procedure, let us find out what is a tidy wound. According to the Rank-Wakefield classification system, these are wounds inflicted by sharp instruments and contain no devitalized tissue. Such wounds can be closed primarily with expectation of primary healing. They are usually single with a clean cut, and associated fractures are uncommon in tidy wounds. For examples, they can be surgical incisions, cuts from glasses, and knife wounds. For untidy wound, we'll leave it for the next video tomorrow. For patients with tidy wound, we have to first of all stop the bleeding, and we can do this by elevating the region of the injury above the level of the heart, and after that we have to clean the wound, applying a dressing and take painkillers if needed. But today we'll be focusing on cleaning the wound and applying a dressing. When the wound has stopped bleeding, we have to clean it and cover it with a dressing to help stop it becoming infected. To do this, we have to first of all wash and dry our hands thoroughly and put on gloves. Then we'll clean the wound under drinking quality running tap water and avoid using antiseptic as it may damage the skin and slow healing process. Pat the area dry with a clean towel, and after that we will apply a sterile adhesive dressing such as a plaster, as is shown in the right upper corner of this slide. Also, we ought to keep the dressing clean by changing it as often as necessary. Use waterproof dressings to keep the wound dry while bathing and showering. We can remove the dressing after a few days once the wound has closed itself.